Yes. All right, let's get started. Welcome. Hi, guys. My name is Ashley Kotkin. I am a volunteer with the San Jose Animal Care Center, as well as Kittens First, which is an organization that partners with San Jose Animal Care Center to provide training like this for the foster program. So pretty neat. We do cool stuff. So welcome to the Kitten program. Hopefully, before you guys joined this class, you had a chance to watch the orientation class / video. If you did not have a chance to do that, please do that. 1 second. Just trying to wait. Sorry, I'm having some technical difficulties. I want you guys having a look at me looking at the corner of the screen. Okay. All right. Welcome to the Kitten program. So in the orientation video, they talk about all of the different options there are for volunteering with the San Jose Animal Care Center, as well as for volunteering with Kittens First. I'll do a brief overview of all of these options, but please go back and watch it and see if what works for you. This class is geared toward fostering. However, all of it does apply, or most of it does apply to the kitten nursery. So just keep that in mind as we go through this class. If it feels like it doesn't apply to you, that's okay. Just be patient with us. All right, so the first thing that we're going to talk about primarily is fostering. So fostering is a long-term commitment. Generally, it's 1 to 8 weeks that you might have a kitten in your care, depending on that kitten's health status, behavioral, etc. We need fosters for sure. We need long-term fosters. If that's something that you're interested in doing. We also offer a bunch of classes on different types of kittens that come in. So we'll talk about that in a second. We also need overnight fosters. This is something that's really, really, really important. And these overnight fosters need to be able to bottle feed or feed transitional kittens. And we'll talk a little bit about those in a second as well. But we really need people who are able to take a kitten for the night, give it an extra opportunity to find rescue the next day. A lot of times these kittens are sick, but most of the time they're just young and they're too young to stay at the shelter overnight by themselves because they need help eating and going potty. So we need people who can help with that. And it's just, getting up a couple times throughout the night. It's not so bad, but we really need help with that. We also need help in the nursery. So during the day, as kittens come in, they need to be fed and cared for. So we need people to help support shelter staff with that. We also need transporters. So people who can help bring kittens to and from the shelter to fosters and rescues. We also are looking for people who are interested in doing medical stuff. If critical care is your jam, we are looking for people to help with doing health checks and talking to fosters about what's going on with their kittens and making phone calls and giving vaccines. And we also need help with administrative stuff. So if any of those things light your fire, this class should prepare you for a bunch of that. And then if you're interested in like nursery, transport, medical, etc., please send us an email. We'd be happy to talk to you more about how to get into those things. All right, so right now, in this moment, you are here with us in the level 1 class. This is the Weaned Kitten class. We are focused primarily on kittens that are fairly self-sufficient. Once you take this class, you'll be sent a quiz in your email, and Allie will talk more about the details on this. And you'll also receive a recorded version of this class, so you can watch it again. If you want to hear my voice over and over, you can do that. And then please be patient with us. It takes 1 to 2 weeks for us to go through the whole approval process once the classes are complete and the quizzes are complete. This is because shelter staff has to validate all of this information, and they need to do all of their legal mumbo jumbo with the shelter systems. But once you've been approved, then you'll be able to join. Sorry, my dog also wants to participate. You'll be able to join the Facebook groups where we network kittens for foster. So as kittens come in and they need placement, we'll post them on Facebook. And that's where you can volunteer to take kittens into your home, or you can sign up for shifts in the nursery, and of course get kittens. And yeah. So after you complete level 1, there are levels 2 and 3. These are live classes taught by Allie and me. Allie's gonna teach the second half of this class, so I gotta hurry up. high. And then, so we've got bottle baby class and transitional class. These are for the itty bitties. But we also offer medical classes. So if you're interested in helping kittens that have upper respiratory infections, diarrhea, ringworm, or just need some extra snuggle time, these require some special skills. And we have classes for those, and we really would appreciate your help. So if that's something that you want to do, please, 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 please. A lot of these classes are actually already up on YouTube, so check them out. All right. Please hold your questions till the end, just because this class is very thorough. It's very detailed, and you're probably gonna be like, oh, I want to know more about this. We might probably will cover it. So please be patient through all of that. I know I'm saying that a lot, but you'll probably get most of your questions answered. Yep, this class is also for volunteering in the nursery. Yep, so we are going to talk about like housing and where to stash your kittens, but a lot of this stuff does apply to nursery, so this class is required for that. Okay, cool. So welcome to Level 1 Weaned Kitten Care, presented by Kittens First for the San Jose Animal Care Center. That's us, right, Annie? Yeah. All right, so learning objectives for today. There are 5 key things that we want you to get out of this class. The first is how to provide adequate housing and care for weaned kittens. So where do you put them, right? And how do you keep them alive? That's the first thing. Number 2, identify the key signs of health. How to identify if something's wrong, right? Know what's normal and what's not. Know when and how to seek medical care. So we are very, very fortunate that the shelter has sufficient resources to be able to provide medical care to all of our kittens and make sure that they stay happy and healthy and make it to adoption. So we want you to utilize those services. It's really important. We want to see you guys be successful. We want to see our kittens be successful. So we're going to talk about how to do that. We're also going to talk about how to play, socialize, and desensitize your kittens to all the crazy stuff that you do in your house so that they don't hide every time you turn on the vacuum. And then finally, we want to talk about how to clean and disinfect all the stuff that they touch, because kittens are gross. You're gonna hear me say that a lot today too. So on to the next, kitten development. So we talk about 3 main stages of development when we're talking about kittens. We talk about bottle babies, transitionals, and weaned kittens. Bottle babies are going to be entirely dependent on, well, they're all gonna be entirely dependent on humans to survive, but they're gonna be entirely dependent on formula. They're not gonna be able to eat or process meat. They're gonna have no teeth. Their eyes are going to be closed, ears are going to be closed, and over those first couple of weeks, those will start to develop, right? But bottle babies, they need a lot of help. They need to be fed every couple of hours, even through the night. They need a constant source of heat, etc. Then as they get older and they start to show interest in using the litter box and starting to play, and those ears start to go up and those eyes start to open and they start to wander around and climb, and they might start to grow in those side teeth, right? Those side teeth are what's going to make it sure that they're old enough to process meat. So once those back teeth come in, then we can start introducing meat. That's the transitional phase. And then finally, you have your weaned kittens, and those are going to be mini cats. Those are going to be running and playing and biting and chewing and all that good stuff. And they're going to need mostly help with socializing, right? They'll be using the litter box pretty confidently, or they should be. They should be eating on their own pretty confidently. And yeah, so guys, please save your questions till the end. We're going to talk about all of the details, I promise. So just hang tight for me, okay? Okay, so first question for you guys though, what do kittens need to survive and thrive? Can you put it in the chat? What do you guys think that kittens need in order to grow big and strong and survive and just, you know, become healthy, happy cats? What kind of stuff do we need to provide for them? Food and water, yep. Shelter, nutrients, playtime, love, yep. Warmth, yes. Play, yep, absolutely. Anything else? Socialization, clean water, exercise, all great answers. Anything else? All right. Awesome. Food and water, a heat source, a safe cage or room for them to exist in, a litter box, toys, medical care, socialization, monitoring, and play. So now, but before we talk about what things you need to have and where to put them, we're going to talk about quarantine. So this is really important. When we're talking about housing kittens, so the first thing that is really important to know is that your kittens must have some sort of enclosure to exist in. And we'll talk a little bit more about what that needs to look like in a minute. But they must have some sort of enclosure that they stay in. Daniel, sorry, cats. Okay, so kittens can have diseases that can infect your home, your pets, and even you. There are some diseases that can make you sick, and we don't want that. And kittens are coming off the street, so we want to make sure that you're keeping your home safe for you and your family and your pets, but also for your kittens. And quarantine is mandatory in our program. So if you take in a kitten that didn't come from another foster home, that came from the shelter, there's a mandatory 14-day quarantine period. So what does that mean? That means that they have to have their own space with their own supplies, where you can ensure that if you touch a kitten, you're not going to immediately touch all of the things and then spread germs all over your house. Okay. That means that they're not going to put their nose and their feet and their tails all over your carpet or your bedding or your couch or any of those things. We don't want anything that cannot be easily cleaned and sanitized should not go near a freshly baked kitten. Okay. So how do we do this? Well, the first thing is that they need to have their own space to exist. They need a playpen or a cage. Now, depending on the age and the size of the kitten and how many kittens are in the litter, that can impact where you keep them. If you have a room that you can keep them separate in, that's awesome, but they still must have a playpen. The reason for this is we don't want unsupervised kittens going anywhere. Kittens are like babies. They are babies, and they will get themselves into trouble. They will find the hole in the wall that you didn't know existed, or the hole in the lining underneath your couch. They will find it, and they will get stuck, and you'll be sad. So it's really, really important that we're keeping our kittens safe. And also for that quarantine period, we don't want germs all over our house. Now, a couple of things that when we're talking about quarantine, yes, we're talking about upper respiratory infections and colds. We don't want to spread those. We don't want to spread parasites that come from poop. But most importantly, there are diseases that are viruses like panleukopenia that are very contagious, and they are deadly to kittens. So it's really important that we keep the ick contained. So if, God forbid, a kitten comes in with one of these diseases, that you aren't limiting yourself to having that be the only litter that you foster, because you could potentially put future litters at risk. Okay, so you need to have a playpen or cage, and I'll show you a couple examples of playpens. When we talk about cages, we tend to only like cat condos. The reason being that, or like hamster cages, the bars and dog crates are too far apart. So depending on the age of kitten, they can either get out or they can get stuck, they can get hurt. We don't want any of those things to happen. So either you have a kitty condo that's designed for cats, or you have a playpen like this, and I'll show you, or like one of those pop-up playpens, and I'll show you what that looks like in a second as well. If you have pets or small humans in your house, if you got kids, you want something that has a top on it, so that you can keep your pets and your kids separate from the kittens and keep them safe. You want to put them in a room that does not have carpet. Carpet is not easy to sanitize. Anything that's porous, like bedding, couches, chairs, cat trees, anything expensive that you care about that you wouldn't want to spray with bleach, you don't want it near your quarantined kittens, okay? We want to keep them in a place that's warm, so 60 to 80 degrees Fahrenheit, because kittens can't retain their own body temperature. And of course, if possible, we want them in a room where there's natural light, but that is not a requirement. So during quarantine, you want to make sure that when you handle your kittens, you're either wearing gloves or you just wash your hands after you handle your kittens. But you don't want to like touch your kitten and then be like, oh no, and then touch your bed, and then touch your door handles, and then touch the refrigerator. And, oh my God, I forgot. I put food in the microwave. And then, don't do that. Wash your hands after you touch your kittens. Don't spread germs, okay? If you are hanging out with your kittens, like let's say you jump in the playpen and you're hanging out with them, or you take them into the bathroom so that you can run around and play with them, just spray down the space afterward to sanitize it. And then change your clothes, so that way, again, you don't have kittens rub it all over you, and then you just lay in bed and then suddenly your cat catches a cold. We don't want any of that, right? And yeah, so change your clothes. I like to like have like a robe that I wear in the kitten room or when I'm handling the kittens, and then that stays separate so that way my clothes underneath don't get gross. And I don't have to worry about spreading germs. The incubation period on most diseases is less than 2 weeks. So that's why we have that 14-day quarantine period. That will ensure that your kittens are generally safe after that 14th day. Also, your kittens will have a health check every 2 weeks, and Allie will talk more about that process. But at that health check, staff will be able to assess whether your kittens are healthy enough to leave quarantine or not. Okay, so how do you socialize? Because we want you to be able to hang out with your kittens and have fun, right? So just cover yourself up, wear gloves, or just make sure you wash your hands really well. And just because kittens are in quarantine doesn't mean that you can't handle your kittens. It doesn't mean you can't snuggle them. Just be smart about it, and don't like take them into your living room. Don't take them into your bedroom. Like if you want to hang out with them, you want to put them down on the floor. Cover your floor. Take them in a place with a hard floor that you can wipe down, and then I like the bathtub. Bathtub's a good place to hang out with kittens. You can play with them for a little while and put them back. And remember, it's just 2 weeks. It's not so bad. All right, so after quarantine, we made it. Your kitten's healthy. They're no longer leaking from any of their orifices, and we can hang out with them outside of their quarantine space. Again, they still need to be in a playpen or a cage, especially when they are not supervised. You want to try and move them into an active part of your home if they weren't already. So a living room, or any place where there's a lot of activity, because we want to expose them to stuff. Ideally in a place that still doesn't have carpet. You can cover your carpet with like a cheap shower curtain liner, something that can be easily bleached and rinsed and dried and then put back. You want to exercise them for like 20 to 45 minutes at a time, and then give them a potty break because they are still babies. They've got tiny little bladders, and you don't want them to pee in your laundry hamper. Okay. And then you want to try to aim for like 2 to 5 hours a day of socialization. Okay, so after quarantine, it's also really important that you kitten-proof your house. You're going to be able to give them supervised time outside of their cage, but again, it must be supervised. And you want to keep them in a place that where they're not going to be able to get under ovens or behind ovens or dishwashers or washing machines, into that dresser that you really like that used to be an antique until your cat peed in it, or like I said, like the lining of furniture. If there's a place where you don't want your kittens, they will find it if you're not watching them. So it's really important that if there's something that's really important to you, that you block it off. Like I have a pull-out couch, so I lined the bottom with pool noodles so they can't get in there, because that can be very dangerous for kittens. I also have cardboard that I taped underneath all my cabinets so that the kittens can't get into the cabinets in my kitchen or behind any of the appliances. And then again, of course, never leave your kittens unattended. Okay, now we know a lot of you very likely already have pets, which is awesome. We love pets. We love animals, and we want you guys to enjoy your pets as well as your fosters. But we want to keep them safe. So the first thing is, we love if people take this class and go and volunteer with another rescue organization. Like if you find a rescue who's looking for fosters, please do that. That's amazing. We appreciate that. Just don't foster for another group at the same time that you're fostering for us, even if it's a different species. This is really important because there are communicable diseases both ways. The worst thing that could happen is that your kittens finally clear quarantine, and then you're taking kittens from somebody else, and then they get your kittens sick. That's fun for nobody, or vice versa. Another organization is not going to appreciate it if you bring kittens in and then you get their kittens or their puppies sick, right? So please be mindful of that. Also, if you're thinking about adopting a kitten, that's awesome. Just don't do it while you're fostering for us. Keep it separate, because anytime that you bring animals into your home, it's going to be stressful for all of the animals involved. If you don't introduce them to your pets, then it's not a problem, right? They don't have to know each other. They don't have to meet each other. It's a lot less stressful. But when you go through that introduction process, there's a lot that needs to happen in order for that to be successful. And you need to be able to focus on that to avoid having stress, or to avoid anybody getting sick. And then, of course, never leave your kittens unsupervised with your pets. Even if you're like, my dog is the best foster mom, she loves all of the kittens, and she's gonna be so good, and we're gonna like be on the dodo, and it's gonna be great. We love that. My dog, she loves the kittens. She wants to sniff their butts until the cows come home. However, I had fostered like 250 kittens and she had never had a problem. She loved all of them. 251st kitten, she tried to eat it. You never know, because if a kitten is sick or if a kitten has something wrong with it that you don't know, your pets might react differently to those kittens. So always do a slow introduction, always after quarantine, maybe sniffing through the playpen. But just remember that anytime that you introduce your pets to your kittens, that you're doing so at your own risk. And there is significant risk with it. So sometimes it's just not worth it to even go through that process. Okay. All right, so setting up a house for a weaned kitten. Here's 2 examples of playpens. So the one on the left, these are the Tespo panels. You can get them on Amazon. And they're like a plastic, like acrylic plasticky. And they're great. They're easy to sanitize and clean, but they don't have a top. So this is not ideal for older kittens or spicy kittens that aren't unsocialized. We don't recommend that. You want something that has a top on it so they don't escape. Like the one on the right, these are awesome. You can get them for like $30 on Amazon. And they have a zippered top. And they're easy to clean, easy to sanitize, and it's a safe place for you to keep your kittens and make sure that they don't get out when you're not watching them. You will want to make sure that your litter, your food and water, and that your blanket or bedding with a heat source underneath it, with like a heating pad underneath it, are equidistant apart. And then you want to have a couple toys in there for them. But you'll notice that neither of these spaces are very cluttered. You want it easy to clean, easy to sanitize. Kittens are gross. I'm going to say it again. A kitten will run through their litter box and then they will run through their blankets. And it's a lot easier to not have to replace a ton of things over and over again, right? So keep it simple. Okay, litter and litter boxes. We will provide you with a litter box and litter. We use non-clumping unscented litter. This is like feline pine. We really like this because it's not going to kill your kittens. So they won't try to eat it in most cases. If your kitten does try to eat it, please let us know. But generally, this will keep your kittens from getting an obstruction because kittens will eat clumping litter and it will clump in their tummies and they'll get sick and nobody wants that. Unscented litter too, kittens are sensitive. And again, we'll provide you with litter, but this is if you want to get your own, you're welcome to do that. Some people like to buy their own stuff. So just make sure that it's non-clumping and unscented. And also that the litter pan is shallow enough that they can get in and out of it easily. All right, you're going to offer kibble and water at all times so that they can get at it whenever they want. Then you're going to offer warm, wet food 2 to 3 times a day. All of the feeding guidelines are in the foster manual, and food is all dependent on what's donated. So that can change from time to time. If you need more supplies, please email shelter staff with at least 24 hours notice so that they have time because things are really busy right now. And we want to make sure that you get the stuff that you need. Shelter will provide everything that you need, like a heat source, a scale to weigh your kittens, food, all of that. All of that will be provided. The only thing that's not provided is an enclosure, so a playpen. So that is something that you would have to get for yourself. And again, all the details on supplies are in your foster manual. All right, so now you know all the things that kittens need to not die. Can you guys tell me, you're looking at this picture, what would you change about this photo? What about the playpen? Carpet, yep, no carpet. Open top, yep. Good. Yep, the bars are too far apart. Yep. Too cluttered, way too cluttered. Yep, what else? Lots of porous surfaces. Yes. So it's okay to have a bunch of kittens in one space. You want to make sure that if you have multiple kittens that you provide multiple litter boxes. Yep, it doesn't look like there's a heat source. Nope, that's right. Anything else? What kind of porous surfaces would you remove from this space? What things in this space could not be easily sanitized or washed? So some of the beds probably could go in the washing machine. Those are okay. The rugs, yep, rugs are definitely problematic. And also the cat scratchers. Yep, exactly. The cat scratchers. Those, if these kittens were sick, those cat scratchers would have to go in the garbage. And also, so like you see the pen on the outside, so that's an X pen. And those are intended for dogs, they're not intended for cats. Your cats will absolutely climb that and get out. And yes, the mirror could fall over. Yes, don't put anything that could accidentally crush your kittens. That is really important. Okay, cool. Good job, guys. Excellent, excellent job. All right, so this is the last section for me. Cleaning and disinfection. This is my favorite part. All right, so what do we clean? Everything. Everything needs to be clean. It's really important. Kittens like to be clean. Cats like to be clean. So that means you need to scoop their litter box. If something's in it, if their litter box is dirty, scoop it. Easy peasy. You want to make sure that you remove any soiled blankets. Kittens are gross. They're gonna step in poop. They're gonna step in food, and they're gonna walk through everything. So just, check all their stuff, make sure that it's clean and dry, right? And you want to make sure that you change their water and kibble. When some kittens like kibble, some kittens don't, that's cool. But they will get gross stuff in their water bowls. If you wouldn't drink from their bowls and eat from their plates, like, don't expect them to. And then of course, wipe anything that's obviously poopy. So how do we clean? Now this may seem obvious, but it's not necessarily. So you want to wash everything thoroughly. You want to rinse it and dry it. Now this is really, really important. The reason why you need to dry it afterwards is because chemicals can interact, number one, and number two, because kittens will eat anything, and so you want to make sure that they don't accidentally lick up some chemicals that you use to clean with. Okay, you want to make sure that everything looks and smells clean, and you want to use soap or some sort of safe household cleanser. Dish soap is fine. We like Mrs. Meyer's and Seventh Generation, anything that's gentle. And then we recommend having kitten specific cleaning stuff, so like a kitten specific sponge that you clean with, because you don't want to wash your dishes with a poopy sponge. Okay, so what is the difference between cleaning and disinfecting? Can you guys put some ideas in the chat? What do you guys think? What is the difference between cleaning and disinfecting? Mm-hmm. Yep. Cleaning is removing what you can see. Exactly. Yep. Anything else? Disinfecting kills germs. Yep. Anything else? Okay. So what is disinfection? When we're talking about disinfection in terms of like fostering or in the kitten nursery, like in the kitten nursery at the shelter, the volume of kittens that come in with all types of ickiness is significant, right? And we want to make sure that we don't end up with an outbreak. That's really, really, really important. So everything needs to not just be cleaned, but sanitized. So how do we do that? The first thing is you're making sure that you're using something that is appropriate for what we're cleaning and sanitizing, what we're disinfecting. So you want to use a disinfectant that's going to kill feline bacteria, viruses, and fungi. We've all gotten used to having to like sanitize all different things because of COVID. But Lysol and other antiviral and antibacterial products for humans are not necessarily going to kill all the feline viruses and bacteria and fungi that we need to worry about. So we like to use bleach or rescue disinfectant. Rescue disinfectant is hydrogen peroxide based, and it comes in both a concentrate or a ready to use spray, as well as wipes. And we really like those wipes. Those are really easy to use. And bleach is another option. Now, both will discolor fabrics. So, again, don't put your kittens in a place where you don't want bleach to exist. And you want to make sure that you only use one or the other, because again, they will interact and you will end up in the hospital. So one or the other, not both. Okay. So what do we disinfect? You want to disinfect your playpen or cage, your litter boxes, your laundry, your bowls, your toys, brushes and combs, and carrier. Anything that's soft and porous, like blankets and that kind of stuff. If it can go in the washer and dryer, that's perfect. Wash it on high heat with bleach. A plus. Anything small like bowls, plastic toys, like, like the jingle balls, brushes and combs, all of that stuff, you can just fill your sink with water and bleach and just let it sit for 10 minutes. And that's a really great way to do that. And then there are play pens, litter boxes, carrier. You can spray all of those down. I do it in my shower, or you can spray it outside and then just spray it in the shower. So how do we do that? The first thing is you want to make sure that you're keeping yourself safe. So if you can, wear gloves, wear a mask, wear goggles, do it in a place that is ventilated. Well, you want to make sure that before you disinfect. So somebody asked a question about bleach with chlorine base should not be mixed with urine. So you shouldn't just be pouring bleach directly into a dirty litter box. You want to make sure that you're washing everything first. So that should not be an issue. So the first thing is that you're going to protect yourself. So you're going to wear gloves if you can, wear a mask to protect your face and your lungs. And then you want to make sure you clean thoroughly first. So if you want to make sure that it is visibly clean, that you've washed, rinsed, and dried everything, and then you will disinfect. You can soak in one disinfectant, so 1 to 32 parts bleach, 1 part bleach to 32 parts water, clarify, and then rescue wipes or spray. And again, one or the other, not both. And then you want to let it soak for 10 minutes. It needs 10 minutes contact time in order to be effective. And then again, you want to rinse it really, really, really well, and then dry it before you put it back with the kittens. So how to clean and disinfect. The first thing that you're going to do is you're going to remove all of the items from the play area, right? What I like to do is I like to put my kittens in their carrier and then clean and sanitize everything else. And then once everything else is set back up, then I'll take the kittens out of the carrier and then I'll sanitize the carrier. But again, so you're going to clean everything, make sure everything looks clean and pretty. Then you're going to rinse it and dry it really, really good. Then you can disinfect, wait 10 minutes, and then rinse and dry again. Don't put anything back in kitten space that has not been fully rinsed and dried, again, because you could risk getting your kittens sick. So how often do we do this? You're going to clean every single day. If it looks dirty, clean it. If the blankets are gross, take them out, put a new blanket in. And then we're going to clean and disinfect every week and in between litters. The reason why we ask you to do this every week is because of the incubation period on some of these parasites and other gross things. If your kitten has a parasite, for example, their treatment is generally going to be 3 to 5 days. Sometimes it's a week. But once they heal up, you don't want them romping around in a place that's coexisted with parasite poop, right? You want to make sure that everything's clean and sanitized. Otherwise, they will just get sick again, and nobody wants that. So every week will help to prevent reinfection. And then in between litters, obviously, we don't want to transmit diseases from one litter of kittens to another. So how do you keep your kittens clean? Because kittens are gross. A clean kitten is a happy kitten. Kittens rely on mom to help teach them how to clean themselves, right? And as they're learning, they will do it instinctively, but they're not going to be great at it at first. So they're going to need your help. So the easiest way to do this is with a warm, damp cloth. You can take a little cup or a bowl and fill it with warm water with a little bit of either dish soap or baby shampoo. And then you're going to clean them from the face to the body to the butt. Now, obviously, only do this if your kittens are visibly dirty. No reason to introduce water if you don't need to. And then you want to make sure they get completely dry with a towel and brush and fluff as needed. Now, kittens, again, they cannot retain their own body temperature, especially if they're sick or they're skinny. If they're, if they're needing to put on weight, or if they have an upper respiratory infection or diarrhea or whatever it is, if their immune systems are compromised, a cold kitten can get sepsis or just can get really, really sick and they can die. And we don't want that. So no bads. Now you may go on the internet and go, I saw on the internet, on YouTube, Kitten Lady, she bathes her kittens. We don't bathe our kittens. Now, here's why. The first reason being that, again, we're taking kittens fresh off the street, and they have the potential to be very sick. We don't know what's going on with them yet, and we don't want to expedite the process of them getting sick. We want to give them an opportunity to get healthy and strong and not tempt fate. So if you get a kitten that's gross, like let's say they've got a crispy tushy, or they like get really excited about eating and then they get meat all over their face, warm, wet washcloth should do it. It should be sufficient to remove any ickies. If you get a kitten that is so gross that you think it needs a bath, that kitten also needs medical attention. So if you get a kitten, like let's say, and generally no one will hand you a kitten that is completely disgusting and needs a bath. It's very rare. They might have fleas, which we'll talk about in a second. But generally, you're not going to get a kitten handed to you that is very gross. However, a kitten can develop diarrhea or something of that sort, in which case you want to make sure that you're getting medical care, and then the shelter can walk you through how to give them a bath if it is completely necessary. But again, we want to try and avoid that because we don't want to introduce more factors for them to get sicker, right? So fleas. All of our kittens are treated at the shelter with flea treatment. It can take 24 to 48 hours for those fleas to die, and it can be hard to watch your kitten scratch for a day. We understand that. You can help alleviate some of their suffering by taking a flea comb and combing them and pinching off and then drowning the fleas in some diluted soapy water. It doesn't need to be dish soap. It just needs to be something that's very bubbly, and that will something that's sudsy, that'll kill the fleas. Again, we don't want people giving flea baths unless you are concerned about like flea anemia. And in those cases, again, that's a decision that needs to be made alongside shelter staff, because a kitten that is potentially very sick is not a kitten that we want to submerge in water. Also, bathing does introduce opportunities for them to get sick because they can aspirate. If they get water in their nose, in their mouth, their eyes, their ears, that can introduce the opportunity for pneumonia, which is another thing that we don't want kittens to get. So please trust us. Don't bathe your kittens, okay? And if your kitten gets super gross and you're like, my kitten needs a bath, please talk to shelter staff before you do it, okay? That's all I got. How'd I do? God, 45 minutes. I'm getting better at this.
Okay, so we are going to go over monitoring. Okay, so by now you've probably gotten the idea that kittens are pretty fragile. They can decline really fast. So monitoring is extremely, extremely, extremely important. This is what will save lives. So we want to make sure that we can intervene as early as possible, so that we can get them treatment and that they can stop declining and stay healthy. So this is a monitoring sheet for weaned kittens. This is just an example of some of the things that you're going to have to keep monitoring and keep track of. We have different ones for unweaned kittens too. So do any of you know what the most important thing to monitor in kittens is? Can you type it in the chat? Yes, weight. Perfect. All right, so if for those of you who are newer or maybe didn't know this, if you only remember one thing from this presentation, please remember this. It's that weight is the #1 indicator of health in kittens. Something that we have seen in the past is sometimes fosters will wait until the kittens have more of obvious signs of illness like diarrhea or like boogers or crusty eyes or something, and then they'll get medical care. Before any of that happens though, they'll always stop gaining weight. So it's the best way to spot and treat any potential issues before they get worse. I also want to emphasize that it is a weight plateau. So it is not weight loss, but it is failure to gain weight. So when you weigh your kittens, we weigh in grams, so start getting used to grams. The shelter will provide you with a kitchen scale that will weigh in grams. We want you to weigh it consistently. So weigh at the same time every day. What we recommend is it's easiest in the morning when their stomachs are empty. So say, you wake up, you get them up and they say hi, then they, ideally they use their litter boxes and get rid of like that dead weight, and then you can weigh them before feeding them. The thing about kittens is that they grow almost linearly. So what we would like to see is a gain of at least 15 grams a day. At this age, they're weaned, so they're eating a lot of meat products. So they are ideally going to gain between 20 and 50 grams a day. You're going to see like pretty steep gains, but at minimum 15 grams a day. If you plot your kitten's growth, then you'll see that it pretty much falls along that line of best fit. And then at any point, if your kitten is gaining less than 15 grams a day, please seek medical care. Okay, so can you guys type in the chat for me what normal kitten poop looks like? One of the things about fostering is that you have to be unapologetic about talking about poop. Post poop pictures, give us poop pictures. We love poop pictures. I have a whole album of poop pictures. Google thinks that they're pictures of cooking. They are not. So it's just a really wide range of colors and consistencies. So don't be afraid to talk about the poop. So, yep, formed. There's a certain type of candy that kitten poop should look like. Does anybody know what that might be? Yes, Tootsie Rolls. Just so you remember it forever and never eat Tootsie Rolls again. I'm sorry for anybody who really likes them. This is your fecal score chart. So this will be in the foster manual. So get used to talking about poop in terms of its fecal score. Write it down in your monitoring sheet. If your kitten has diarrhea, staff will ask you what their poop score is. So anything that's a 2, 3, or 4 is okay and considered healthy poop. Where we get concerned is the 5, 6, 7. So diarrhea is the most common health issue that we see in kittens. Diarrhea can be pretty dangerous for kittens because it can dehydrate them. When they get dehydrated, then they start declining. So we need to make sure that they stay hydrated. It's also very easy for a 5 to turn into a 6 or a 7, and it's harder to, without treatment, get a 6 back down to a 4. Diarrhea is anything that's a 5, 6, 7. If you see anything like that, make sure to seek medical care ASAP. Something that we also consider diarrhea is if your fecal score is a 4 or a 3, but your kitten is pooping a lot more than its siblings or a lot more than you think it should, so like more than 3 times a day, that can also be considered diarrhea. Okay, so I talked about seeking medical care, and here's how you do that. So every appointment we have is booked online. All of that information will be in the foster manual. When kitten season really ramps up, which it already has, and it ramped up very fast this year, sometimes appointments aren't going to be available online. Make sure that you don't wait and that you call or text if there are none available. You can also schedule a video consult if none are available. There's several different venues for communication because we want to make sure that you get that appointment for wellness or for a sick kitten as soon as you need it. Every appointment, obviously bring your kitten in a carrier. Cover the carrier with a towel or a blanket. This is because the shelter is is employing fear-free practices, and covering the carriers helps keep the kittens calm. Make sure to bring your monitoring sheets and paperwork, and then you will call or text the kitten phone on arrival. Your routine appointments are your wellness appointments. So these are your health checks that happen every 2 to 3 weeks. Every appointment you'll get, your kitten will get an exam, any age-appropriate vaccines, dewormers, and then flea treatment if it is time. What we really recommend is that when you pick up your first kitten, or anytime you pick up a new kitten, just go home and make that first wellness appointment right away. It's online, so you can even do it like on your phone in the parking lot. Make sure to stay on schedule because appointments do fill up fast. So one thing about quarantine is that our quarantine is 14 days, so that's 2 weeks. You have to get permission from staff to let your kittens off quarantine. So your first wellness appointment is a really great time to ask shelter staff if you are free from quarantine. Okay, so based on what we've learned so far about monitoring, can you please type in the chat for me when you should seek medical care? Yes. Perfect. When the kittens stop gaining weight, or there's a plateau, and then diarrhea. Yes, less than 15 grams, fecal score of 5 to 7. Awesome. You guys are super detail oriented. That is great. All right, so there's a whole bunch of things that can happen with kittens other than weight loss or failure to gain and diarrhea. So there's urgent things and there's not so urgent things, but all of these things are things that you should contact shelter staff for or reach out to book an appointment. The urgent things are, inappetence, so not eating, diarrhea, vomiting, not gaining weight, any kind of lethargy or weakness or lack of energy, and then injuries and wounds. Anything that is not considered urgent, but you will still need an appointment within the next 48 hours is constipation. So if your kitten doesn't poop for 36 hours, any sort of signs of upper respiratory infections, so watery eyes or nose, any boogers or congestion, hair loss or itchy skin or ears, that can be a sign of ringworm, which is something that is not that bad. It's a fungus. It's treatable, easily treatable, but it is contagious. So we want to make sure to nip that as soon as possible. And then, of course, any other parasites or worms. Okay, so video consults are something that we introduced this year, so people don't have to drive to the shelter as much. When you go to a sick kitten appointment, we want to follow up with you like 48 hours later to make sure that the kitten is in fact improving and see if we need to go to plan B of treatment. You can also use these for like general advice, or if you just have a question, or if you aren't sure if you need an in-person appointment, or if you need an in-person appointment but there's no slots available. This is kind of sort of a catch-all, but it will help expedite the whole appointment making process. So we mostly use these to triage diarrhea, but you can use these for anything else other than emergencies. So in-person appointments are reserved for if one is wellness, and then the second is if your kitten is really sick, or there's something like really funky going on with it that requires a physical exam, or if you say you have a video consult and you said, oh, I came in for diarrhea 2 days ago and the diarrhea hasn't resolved. Or you say, oh, I came in for diarrhea, but my kitten also threw up this morning. That's going to require an in-person exam. So it might easily turn into an in-person exam, but we will help you book that. If your kitten needs to be seen immediately, or if there is an emergency, please call or text the kitten phone. And then if there's no response, call the emergency numbers. All of these numbers and all of this contact information is on one page in the foster manual. The emergency vet is MedVet. If there's any like severe trauma or injury, like gaping wounds or blood, a lot of blood, we understand that accidents happen. Please just make sure to get the kitten care as soon as possible. If they are in respiratory distress, if your kitten is limp and not responsive, if you have a combination of liquid diarrhea and vomiting, and then of course seizures. Generally, emergency care is used after hours or in like extreme emergencies, but either way, you have to call shelter staff first. You're going to call a supervisor to get permission to go to the emergency vet. This is super, super important because if you do not get approval to go to the emergency vet, you are going to be on the hook for paying for that visit. So make sure that you get staff approval first. All right. How would you know that a kitten is ready for surgery? And by surgery, we mean spay and neuter appointment. Close, it's not 2 pounds. But weight is one of them, yes. Yep, general health and weight. Age isn't necessarily a primary requirement, but it's one of those things that sort of comes with a healthy, chunky kitten. All right, so there are a couple other things. One of them is the surgery diet. So when you take your kittens to the shelter to do a surgery drop-off, they're going to be on the shelter schedule for eating, which is they are eating 2 wet food meals a day, and they are eating kibble all day. So they are going to be eating usually Fancy Feast wet, or Science Diet wet, and then Science Diet dry as well. So the shelter, again, like will give you all of that. So just to make sure, sometimes diet changes can give them diarrhea. So we want to make sure that you are on the shelter diet before you drop them off. The second is weight. So the shelter spays and neuters kittens at 1.5 pounds. So that's about 700 grams. Sometimes you might have a 1.5 pound kitten, but it's not gaining 15 grams a day. And maybe it's, or maybe it has some sort of eye boogers or something crusty or something, or it's sneezing. Just because it's 1.5 pounds doesn't necessarily mean that it's ready for surgery. So make sure to pay attention to these other factors too. It's okay. It's okay if your kitten is larger than 1.5 pounds. We just want to make sure that it's healthy, it's well-rounded, it's adjusted, so that when it goes into surgery, it is as healthy as possible, and it has as little stress as possible. So that brings me to one of the third factor, which is behavior. So when you drop off a kitten for surgery, you are going to be leaving the kitten at the shelter, where it will go up for adoption after surgery. Sometimes, there's a change. It's a change in environment. It's natural for that to be a little stressful for kittens, right? But one of your jobs as a foster is to prepare that kitten as best as possible for their new home. So that means we want to make sure that they're confident, that they can adjust to new environments. Nobody really wants to adopt a kitten that, they take it home and it hides for 3 days. You want one that walks around like it owns the place when it comes out of the carrier. So behavior is a really important factor in making sure that your kitten, A, is adoptable, and B, convince it's, make sure it doesn't get returned. So let's start with play. Can you type in the chat, please, how you should play with a kitten? Yes, no hands, no fingers. Yeah, okay, so that's the main things. No body parts. Use toys, not your hands. On the left, you can see the best playmate, the best toy for a kitten is another kitten, because that's how they learn how to be cats. And that's how they learn that biting hurts. That's how they learn how to communicate. You can also use toys, so kitten appropriate toys like these jingle balls, wand toys or feather toys. But please use all of those with supervision too. You don't want to use hands because your hands aren't toys. Kittens are going to bite, and when kittens are tiny, it might not hurt, but when an adult cat bites and chases your feet and attacks your legs, it hurts. Cats play by using their mouths and their paws and their claws. And that's just how they naturally interact. Those are the tools that they have to play and to hunt. And so naturally, if you use your hands to play with them, they are going to start thinking that your hands are toys. And then you are going to be hunted and bit and scratched. It's not fun. When they're kittens, it's a very easy habit to break. It's something that they naturally do because they want to hunt. When they do bite, make sure not to punish them. Don't yell at them. Don't, pick them up by their scruff. The best way to handle it, I think, is to just get up and walk away. You can try redirecting them onto a toy. So I usually will keep a toy like nearby and grab a toy to try to redirect them. But I found that a lot of times kittens are just sort of like in the zone with their play, and they don't actually, redirecting doesn't work as well. Because when they bite you, they get a reaction out of you and they want attention from you. So they might go for your hands and your feet more than those toys. Just get up, walk away, ignore them until they're able to play appropriately, which ignore them for a few minutes or a few seconds, and then go back, see if they can play appropriately. If they can't, get up, walk away, do it again. They build associations very, very quickly. They learn very quickly. So they'll learn that they're not going to get attention from you if they bite you. Okay, so how should you hold a kitten? Yep. 2 hands supporting their butts is right on the money. So handling kittens. On the left, you'll see ways that you should not handle kittens. So please don't juggle them. Please don't, stick them in your purse. Don't, leave their legs dangling. On the bottom, you can see that a person is holding that kitten by the skin on the back of their neck, so that's called the scruff. A lot of people, think that scruffing is good, it's okay, or that it's like it's a preferred way to hold a kitten because it mimics how a cat mom carries her kittens. The problem with scruffing, especially scruffing a weaned kitten, is that they know you're not their mom and they know you're not a cat. You're also much, much taller than an adult cat, so you're going to be lifting them way higher than their mom would. They are going to be, they might be frightened the first time that you pick them up because they're really high off the ground. So you do want to make sure that you make them feel secure. So you hold them, close to your body, and support their legs and their butts and their tummies, and use both hands. Another thing about them being you being really tall too is that you don't want that kitten to squirm and jump and hurt themselves. So make sure that you have them secure and that they feel safe. Okay, so this is one of the most common questions that we get from newer fosters. They take home one kitten and their kitten has heat. Their kitten is well fed and has water to drink and toys in their playpen and they're healthy. So why won't they stop crying? What do you guys think? Can you put it in the chat? Yep. Lonely is one. Yes, they might miss their mom. At this age, most likely they miss their siblings too. If they need attention, yes. Another one is that they might just be bored. So if your kitten won't stop crying and you've checked all the things and you are confident that it has all of the basic necessities, it's going to get annoying really fast. But the most important thing here is that you don't coddle them. Try not to give them attention when they are crying, and you know that they want attention. All that teaches them is that they just have to scream to get what they want from you. And then you end up with an adult cat that wakes its owners up at 4 a.m. because it wants to be fed, or because its food bowl is half empty, and that's unacceptable. So you want to make sure that you are positively reinforcing when they are quiet, when they are calm, and I will speak a little bit more about that. This is all part of socialization. So a big part of socialization is making sure that your kittens are just used to humans. You want a kitten that turns into an adult cat that is easy to pick up, that doesn't scratch up your arms when you try to put it into a carrier, that it is calm in a carrier. It can go to the vet and be okay and not have to be sedated, and that it's calm and happy and confident, that it's used to being groomed, nails clipped, brushed, all of the things, teeth brushed. So there's tons of things here that you can do, that we want you to do, because these ultimately are the things that keep cats in their forever homes. Kittens have a critical socialization period. It's very short. So it's between 2 and 7 weeks. So between 2 weeks old and 7 weeks old, they are taking every experience, and it is wiring their brains. So if they have a very positive experience, it wires that brain. So if they have a positive experience with you and they know that you are fun and you give them good things and they feel safe with you, then they are going to think humans are that way. If they have a scary experience, it can easily wire their brain the other way and make them think that something that's not, you know, really so scary is pretty scary forever. It's pretty hard to condition, to rewire their brains after this. So unfortunately, because we have sick kittens a lot, there's a lot of, sometimes there's, you know, less pleasant experiences that we have to give them, like oral medication or eye ointment. So what you want to do is make sure that you pair every potential negative experience with a positive experience. So for example, if you have to give your kitten oral medication, and you unzip the top of your playpen and you reach in and you pick them up and you stick a syringe in their mouth and it tastes disgusting, and then you put them back down. The next time that you pick them up, they're going to think that the same thing is going to happen to them. So make sure that the next time you pick them up or the next time you open the playpen, it is to play with them or to snuggle with them or to give them, you know, pets, to give them, you know, a nice positive experience. One thing that I do is I will feed them, I have syringes and I will feed them treats through so that none of them are resistant to syringes anymore. So there's different, you know, positive things that you can, positive experiences that you can supply them that will really, really help in the long run. A really huge part of this is desensitization. So you want to make sure that your kittens are used to common household noises, like vacuums and the dishwasher and the TV. This is why we recommend that you keep kittens in an active area of the house. They also need to get used to you sort of like doing your own thing and ignoring them. Sometimes if you keep them in a separate room and then every time you enter, they anticipate it and they are associate your presence with them getting attention. You want to make sure that you can, you know, get things done and do chores and not, you know, have your cat trip you while you're doing it. There's tons of like YouTube and Spotify playlists that are like 3 hours of kitchen noises or like babies crying or airplanes or construction, stuff like that, which are really useful for practicing desensitization. So for vacuums, for example, I really like doing, trying it while they are eating because they love to eat. So I will give them their meal and then maybe turn on the vacuum in a different room. If they get scared and they run and hide and they stop eating, then I turn the vacuum off and then I will, you know, maybe close a door and then turn it on so that it's quieter. If they are unbothered, then I can move the vacuum closer and closer and closer and, you know, gradually get to a point where they are playing and they are fine with the vacuum running. So the last part of this is enrichment and play. So they're not, enrichment and play aren't the same thing, but they are both fun. So enrichment is when you sort of stimulate a cat mentally and physically to do things that are natural for them. So like puzzle toys, like cats really like smelling things. They really like digging around for, you know, foraging for food. So there's tons of like DIY things that you can do. Like, you know, save your egg cartons or save your toilet paper rolls or poke a hole in like a water bottle and put kibble in it and, you know, make a puzzle toy. These are things that stimulate their brains. You can also combine enrichment with socialization and desensitization as well. So like one of my favorite things, especially during quarantine, is I will carry my, I'll, you know, put on my kitten shirt and then carry my kittens around my house and let them smell things. They don't touch things, but they will smell them. Like I'll open my fridge and they love it, and it gives them enough mental stimulation to take a nap afterwards. All cats go through this cycle that you'll see on the left multiple times a day. So it's hunt, catch, kill, eat, groom, sleep. That is coined by Jackson Galaxy, who is a really well-known cat behaviorist and has fantastic content if behavior is something you're really interested in, like I am. Most behavioral issues can be solved by going back to this routine. So if you have a kitten that is that won't go to sleep, and you need to go to bed because you have to wake up in the morning to go or to to work, and it's 10 p.m. and your kitten won't stop crying, go back to the schedules or this schedule and start off with like a play session so that they can hunt, catch, and kill something, and then you can give them like a small snack before bed. It puts them on that cycle, and if you align that with your own schedule, then you are both happy. For play, interactive play is best because it helps you bond with your kitten. But of course, that's not possible all the time, and kittens love novelty. So you can leave toys in their playpens, like jingle balls, crinkle balls, and then like the little mice. Just make sure that it's not anything that they can eat or ingest. No strings, no yarn, nothing, no, I don't know, hair ties, nothing like that that they can eat and get a blockage, and it's not going to be a good time. So I'll answer that in a second. So with play, kittens have to experience success. So that's part of that routine, right? So they need to be able to catch and kill something. That is why we don't recommend using laser pointers as a primary form of play, because they need to have something tangible to catch and kill. They can't do that with a laser pointer, and so a lot of cats actually get really frustrated with laser pointers, and they can get sort of fixated on it. So if you are playing with a laser pointer, make sure to end the session like on an actual toy or on something that they can catch and kill. Scratchers are also a vital need. The dollar store has really good, cheap scratchers. Make sure that the scratchers you use are cardboard, because those are disposable. It's near impossible to disinfect any other kind of scratcher. We have a question about catnip. Kittens don't react to catnip. So which that is what all the things say. I have also had kittens react to catnip, but it's like not their favorite thing. I view catnip as more of like a treat, but not a useful thing. I think it's more fun for us. So you can try it with them, but I mean, I wouldn't be surprised if your 8-week-old kitten doesn't have a reaction to catnip. And yes, that is a fantastic way to play with laser pointers, is to focus on a treat at the end so they can pounce and then eat the treat. That is great. Okay, saying goodbye. All right, so we get this question a lot, is if you can adopt your foster kittens. So yes, you can have your pick of the litter. However, there's a lot of buts to this. Please remember that there's a ton of kittens, like there's thousands of kittens. We really need your help to continue saving them. Goodbye is the goal of fostering. The purpose of fostering kittens is to raise ones that don't need you anymore and to give somebody else their best friend. If you are fostering with the intent of adopting, please just go back and go through the adoption process at the shelter or with a rescue. If you are fostering to see if you might want to adopt in the future, this is a great way to figure out what kinds of personality traits and energy level and hair length will fit best in your home. So if you're, kind of thinking about it, foster multiple litters. Just, move kittens through your home, and that way they all have, you'll get a better idea of which ones fit best with your lifestyle and with, your current pets if you have any, and then with, anybody else who will interact with the kittens. It is a really, really great way to figure all of that out. They all have such unique little personalities. And it's really fun to see all of them, all of those personalities develop. Remember that if you adopt, you're going to have to take a break from fostering for the benefit of your new family member and for the kittens in the foster program as well. And we really, really do need your help to continue saving kittens. Okay, so we are done. So after this session is over, it can take a few hours to process, so but keep an eye on your email. We will send a recording of this session. We will send a quiz and then another supplementary application if you want to foster. All of the directions are in that too, in the email. Approval can take, between 1 to 2 weeks. It's closer to 2 weeks right now because we do have a lot of processes in place. There's a bit of a backup because there are a lot of kittens. So if you don't receive it or if you need any updates, please email coordinators@kittensfirst.org and we can check on that for you. After you get approved, you will get a welcome email. It will have your level 1 certificate, your foster manual, your monitoring sheet, and then the link to the volunteer portal to see the class schedule, and then of course the links to the private Facebook groups that we have. If you are here to volunteer in the nursery, there are directions in the welcome email that you will receive after being approved. All right, we are done. If you have questions, thank you for holding them until the end. Just go ahead and throw them in the chat and we will answer them as best as we can. No questions? Yes, of course. Is it okay to foster 1 kitten at a time? Yes, it is very much okay. Although it is easier to foster 2 kittens at one time because your kittens will entertain each other. However, the number of kittens you foster at one time depends on your preference. Generally, I would say like 2 to 3 is the number that's in the average litter that's offered for foster. But it's really up to you. The only thing is that for if you're new to the program, we want to make sure that you just foster 1 litter at a time, because you will have to keep those litters separate. The number of weeks for fostering depends on the age and health of the kitten. I think most foster posts will say, this kitten needs foster for about 2 weeks. That is I guess 2 to 3 weeks is about what you would see for weaned kittens. COVID protocols work with, how do they work with the nursery? There's more about that in the next step, but generally it's pretty empty. It's like one volunteer and one staff member at a time. You will get, temperature checked upon entering the building. Masks are required. But there's plenty more details. Generally, we're in a kitten nursery. We're wearing gloves. We're around disinfectant. So you're going to be practicing a lot of like sanitizing and, disinfection and cleaning protocols anyways. What to do if a kitten is difficult to wean and doesn't want to eat solid food. That is in our level 2 class for bottle babies and our level 3 class for transitionals.
Please take
I cannot answer that question in the time that we have left. There are a lot of details. My kittens eat what I give them.
So just to clarify, kittens that are weaned, that are weaned age level 1 kittens, they should be very excited to eat unless they have like a stuffy nose or something. So if they're not super excited to eat, something is wrong and you need to talk to shelter staff about getting them medical treatment. If the kitten is younger than younger than 6 weeks and they're in that transitional phase, then you'll definitely want to take that class. Actually, you need to take that class in order to take any of those kittens anyway. We won't give you a transitional kitten if you haven't passed the class. So should not be an issue unless you find a kitten out in the wild. But yeah, take the class, please. We need you.
And yeah, and you'll get all of those classes. The level 2 and the level 3 are live, and you'll get links to those when you get approved. But we do have the medical classes that are like special skills. So like for ringworm, diarrhea, and URI, and under socialized kittens, and treating panleukopenia. Those are available online, and we will send out a link to those in case it's on the Kittens First website if you want to take a look and do those on your own time as well. To become a medical volunteer, nope, there's no extra steps.
Send us an email.
You would just email our vet and then she'll hook you up. 3 sessions per month for the nursery. I believe the sessions are 3 hours. I think they're 3 hours. Are they 2 hours? I think they're 3 hours.
Used to be 2 hours. It used to be like 2 hours with an hour in between. I don't know if they're still doing it that way. I honestly haven't been to the nursery since they reopened for COVID, so I'm not sure.
I think it's 2 hours and an hour in between.
Honestly, they're grateful for whatever help they can get. So
yeah. And it's all day basically too, until the shelter closes at 5 p.m.
Yeah. Obviously, our ask is that you do 3 shifts a month. If you can't, no one's gonna be like, grr. We're grateful for help. So, but doing more shifts will get you more experience and will make those shifts easier. So we're grateful. Thank you.
You don't need to buy a carrier or a heating pad. The shelter will provide you with those. Well, I mean, actually, I would get a carrier. If sometimes your kittens might come home in a cardboard carrier, but usually they'll give you a plastic carrier to transport the kitten. The playpen is the one like absolute must. If there are any supplies that you need, just feel free to ask the shelter and then they will clarify for you too. And that's all. That the list is also in the foster manual, which you'll get a link to after this class.
Oh, so just to clarify though, cat wipes spray. So if you get rescue disinfectant wipes, please do not use that on a cat. Those are for surfaces only. They will burn your kitties. So please, 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 if you're using any wipes on your cats, they should be unscented baby wipes. But honestly, it's easier if you just use like a washcloth.
I also highly recommend getting gloves, like stocking up. When you use rescue disinfectant, please wear gloves.
And bleach.
And obviously bleach, yes. The rescue will erase your fingerprints. It is a chemical for cleaning and disinfecting. It is hardcore. It is pretty corrosive to your fingers, so please wear gloves. For the nursery, there are shifts on the weekdays and the weekends, but if you are new, you are required to do a few weekday shifts before you do weekend shifts, because the weekday shifts tend to be, there's more staff, and so there's more training, hands-on or in the moment training available for you. All right, any more questions?
Oh, it's scale. Don't forget scale. Sorry. For stuff.
Fostering ends when the cat is ready to be fixed. For that cat, yes. Hopefully you continue and do more cats. Yes. That is when you would make the appointment to drop off for surgery. They are always adopted through the shelter, and they are picked up at the shelter after their surgery. We do not do transfers directly from foster homes into adoptive homes. You're on top of that, you're also not required to find adopters for your kittens. I mean, feel free to advertise them. Feel free to ask all your friends if they want to adopt a kitten. It's cool to watch your foster kittens grow up, but it's not a requirement at all if you don't feel confident in properly vetting a stranger. That is to adopt a kitten that you have raised. That's what the shelter is for. They are vetted, they vet adopters, so it's absolutely not a requirement, but feel free to share and search for adopters for your kittens if you want.
But also know that if you find an adopter, that does not mean that they'll be approved by the shelter. So please keep in mind that everything needs to be done by the shelter. But also know that the shelter is awesome and the people who work there are awesome. And the kittens and cats and dogs and everybody who lives there gets tremendously awesome care. And you shouldn't feel weird or scared or sad about bringing kittens back to the shelter. Bringing kittens back to the shelter is a wonderful thing because it means that they get to go home. And we should be excited about that.
Don't feel sad for the kittens, but you can feel sad for yourself.
Yes, what she said. Yes, exactly. You can miss the kittens, that's okay. Yeah. But know that kittens are going to a happy place, not a sad one.
And I mean, I've never had a kitten that I look on the website when I send mine back. I've never had a kitten last longer than a day on the website. Like, they are funneling out. Like, they get taken so fast.
We're very lucky.
Yeah. All right. Any more questions at all? Oh, 4 years old. Oh, I think mine is 3. So I did the thing where I adopted one of my first fosters, and I've had foster kittens since then, where I was like, if it was socially acceptable, I would consider trading you for my cat because I like you a lot. Like, I love this kitten. I love all the kittens, but some of them I mean, you have favorites. They only get adopted through the shelter. I believe the shelter has a satellite adoption center in the PetSmart right by it, but it's generally for adult cats, not kittens. They also have a lot of rescue partners where in the Pacific Northwest and in Canada, their kitten season isn't as big of a thing. There's a really high demand for kittens, so a lot of sometimes kittens are transported up north. So I have a few fosters that are Canadian residents now. Adult cats, we have not
not through this program.
Yeah, our focus is on the kittens. However, if that is something you're interested in, there are quite a few like fantastic local rescues that are looking for adult cat fosters that you can also email the shelter to see if that is something that you would want to, or to see if that's something that they can do, or if they can give you a recommendation too.
Yeah, they did it at the beginning of COVID, I think, because they were just trying to like reduce the number of animals that were physically at the shelter. But now that staff is more like normalized, I think cats are staying at the shelter now. But they have like pretty rooms with cat trees, and it's painted all pretty. And aren't they like painted like forests and astronauts and stuff now?
The toddler rooms, one of them is like ocean themed, the other one is space themed. So there's all these little catastronauts painted on the walls, and the adult cat rooms are open. They're not, they're not kenneled all the time. They're open space, and then
unless they want volunteers.
Yes, and the volunteers, or need to be, volunteers will go in and socialize with them too and play with all of them.
Yeah, the cat team is awesome. Most of the if there's adult cats that need more care, they will be transferred out to rescue.
All right, so we are a little bit over, and we actually have another class to start teaching. But thank you all for your great questions, and for participating and wanting to save lives. And keep an eye out for your email, and email if you have any questions. That's pretty much it. Thank you. Have a good rest of your weekends.
Thanks, guys.
All right, bye.